Okay, so we've now stitched her up. And we've just moved it to our sort of treatment area, and we're going to fix this shell fracture here. So you can see there's quite a nasty deep fracture through this area, and it actually tracks all the way up across and down here. And this segment is actually quite loose. You can see it moving over here. And there's also, we've put some antibiotic ointment and things in there in the last couple of days. So we're going to clean all that out. And then what we're going to do is wire this shell shut and then glue this area through here. So I'm going to go ahead and clean that up, and we'll come back to you and show you what we're up to. Okay, I've cleaned out this large crack here, got all the dead tissue out and given a good clean up. We've also drilled a hole through here and through here using the high-speed dental drill. And then we've made a little bit of a gutter along the actual fracture line, and that's where our dental acrylic material is going to sit. So what we're going to do now is wire this and this side, and I'm just going to drill a hole over here as well. And on this side, it's that noise we all love. So we're going to put some wire in those spots, and we'll close that up. So we cut ourselves a small piece of orthopaedic wire. Put our wire up through there. Flatten it down on the underside so that it doesn't get caught on anything. And then we're going to twist that wire. And as we do that, this crack's going to come together. It's all about getting a nice even twist, so we pull up as we do it. Okay, so we've wired this shut, got a nice tight little twist on that, and already this segment is really stable. So I'm just going to cut those sections off. One, two, and then I'll bend these down because we don't want them catching on vegetation and things that it may come across again in the future, because these wires will stay in, they'll stay in when they're actually released as well. So just sort of bend those down relatively flat. Like so. And we're going to do one on the other side now. Okay, so we've wired both sides now. One on this side, one on this side. Now we're going to fill up this little gutter that I've made with the dental acrylic. The way we use that are these little capsules. So in here is the dental acrylic, there's a little membrane inside these, keeps the two segments separated. We're going to push down on this yellow tip here, that breaks the membrane. Then we mix it in a special machine called an amalgamator. We put it into this, which is effectively like a little silicone gun, and we just silicone along that edge there. So I'm going to break that seal now. Okay, so this is the amalgamator. This is what we use to mix these little capsules in. And if you've been to the dentist and have a filling, you probably might have seen them using this, but basically it sits in there like that. We shut the door, hit the button, and it shakes away for about 10 seconds. And that's all done. So then we take that out and we use that to fix the shell, which we're going to do now. So we mix that, slips into the front here. We push, cracks that membrane, just give this area a bit of a dry off, and then we silicone. So this is called glass ionomer. It's the same stuff that you have when you have your teeth filling put in your teeth. So it'll set after about a minute. We're going to need another one there, not quite enough. Here's our second one. And just put that along that little gutter that we created to the edge. That looks pretty good. So I'll just wet my finger down a little bit and just push that down so it sits down nicely into the little trough that we cut through the shell. It's already starting to set. A little bit. This little section there. If you don't wet your finger, it tends to peel off as you do it. So this just pushes it, seats it nicely down in the groove. Just a little bit over that top of that wire there. Alright, just let it pat dry. Fixed. Okay, so not only did she have the fracture up on the carapace, the top part, but this guy also had a fracture through the couple of spaces in the plastron, the bottom part of the shell. So this fracture through here, which is actually very well sealed on its own, so we're not going to do anything with that other than we put a wire here just to stabilise that fracture, and that's worked well. She also had a bit of a bridge fracture through this section here, so we've cleaned that out and repaired that with a dental acrylic. So we're going to go ahead and let her wake up now. And you can already see she's starting to do. She's starting to move around, so she's certainly had enough. So we'll wake her up, look at sending her off to a wildlife carer probably tonight.